And how long it's been around. And
Sure thing, sure thing. I'm Dr. Joe Latipo. I'm a physician at UCLA, and I'm a clinical researcher also. And I'm speaking for myself and not on behalf of UCLA. So I want to say that, so I'm thinking of the people who are behind the screens that are watching what you guys are broadcasting. And I want to share with you, because there's so much controversy and the atmosphere is so full of conflict right now, that what this group of doctors is trying to do fundamentally is really to bring more light to this conversation about how we manage COVID-19 and the huge challenge. And that's what this is ultimately about. And bringing light to something means thinking more about trade-offs, about, one of my colleagues said, unintended consequences, and I actually think that's not even the right word. The right word is unanticipated consequences. Really thinking about the implications of the decisions we're making in this really extraordinary time that we're in. So I'm sure people are listening to some of the discussion about hydroxychloroquine and wondering, what are these doctors talking about? And these are doctors that take care of patients, board certified, med school, great med schools, all of that. How could they possibly be saying this? I watch CNN and NBC, and they don't say anything about this. And that's the point. There are issues that are moral issues that really there should be a singular voice, So for me, issues related to whether people are treated differently based on their sex or race or their sexual orientation, I personally think those are moral issues, and there's only one position on those. But COVID-19 is not a moral issue. COVID-19 is a challenging, complex issue that we benefit from having multiple perspectives on. So it's not good for the American people when everyone is hearing one perspective on the main stations. There's no way that's going to serve us. So the perspective most people have been hearing is that hydroxychloroquine doesn't work, right? That's the perspective that most people have been hearing on the mainstream television. And I believe that perspective too, until I started talking to doctors who had looked more closely, some of the physicians behind me here, who had looked more closely at the data and at the studies. So it is a fact that several randomized trials have come out so far. That's our highest level of evidence, and have shown that hydroxychloroquine, their findings have generally been that there's no significant effect on health. There's no significant health benefit. So that's a fact that the randomized controlled trials have come out so far that have come out. In fact, there were 2 or 3 big ones that came out over the last 2 weeks in Annals of Internal Medicine, New England Journal of Medicine, and I think one other journal. It is also a fact that there have been several observational studies. So these are just not randomized controlled trials, but patients who are getting treated with this medication that have found that hydroxychloroquine improves outcomes. So both of those things are true. So there's evidence against it, and there's evidence for it. It is also a fact that we are in an extraordinarily challenging time. So given those considerations, how can the right answer be to limit physicians' use of the medication? That can't possibly be the right answer. And when you consider that this medication, before COVID-19, had been used for decades, right, by patients with rheumatoid arthritis, by patients with lupus, by patients with other conditions, by patients who needed, who were traveling to West Africa and needed malaria prophylaxis. We've been using it for a long time, but all of a sudden it's elevated to this area of looking like some poisonous drug. That just doesn't make sense. And then when you add on to that the fact that we've had 2 of the biggest journals in the world, New England Journal of Medicine and Lancet, as my colleagues say, retract studies that found, interestingly, that hydroxychloroquine harmed patients, right? Both of these studies. And they had to retract these studies, which really is unheard of. That should raise everyone's concern about what is going on. So at the very least, we can live in a world where there are differences of opinion about the effectiveness of hydroxychloroquine, but still allow more data to come, still allow physicians who feel like they have expertise with it, use that medication, and still, talk and learn and get better at helping people with COVID-19. Okay. So why we're not there is not good, doesn't make sense, and we need to get out of there.
It's very simple, and it should be in the hands of the American people. The difficult is that at the moment, because of politics, it's being blocked from doctors prescribing it, and it's being blocked from pharmacists releasing it. They've been empowered to overrule. Why is this not over the counter as you can get it in much of the world? In almost all of Latin America, in Iran, in Indonesia, in sub-Saharan Africa. You can just go and buy it yourself. And the dose, my friends, is 200 milligrams twice in a week and zinc daily. That's the dose. I'm in favor of it being over the counter. Give it to the people. Give it to the people.
Two more who can answer this question, and they know this information.
Hi everyone, I'm Dr. James Stoddard. I just want to add a couple comments to what Dr. Gold was saying. If it seems like there is an orchestrated attack that's going on against hydroxychloroquine, it's because there is. When have you ever heard of a medication generating this degree of controversy? A 65-year-old medication that has been in the World Health Organization's safe essential list of medications for years. Okay, it's over the counter in many countries. And what we're seeing is a lot of misinformation. So I co-authored the first document on hydroxychloroquine as a potential treatment for coronavirus. This was back in March, and that kind of kicked off a whole series of a storm on it. And since then, there's been a tremendous amount of censorship on doctors like us and what we're saying, and a number of us have already been censored. That Google document that I co-authored was actually pulled down by Google. And this is after now many studies have shown that it is effective and it is safe. You still can't read that article. And there's also this misinformation out there. And unfortunately, this has reached the highest orders of medicine. In May, there was an article published in The Lancet. So this is one of the world's most prestigious medical journals in the world. Okay? The World Health Organization stopped all their clinical trials on hydroxychloroquine because of this study. And it was independent researchers like us who care about patients, who care about the truth, that dug into this study and determined that it was actually fabricated data. The data was not real. And we did this so convincingly that this study was retracted by The Lancet less than 2 weeks after it was published. This is almost unheard of, especially for a study of this magnitude. So I apologize to everyone for the fact that there is so much misinformation out there and it's so hard to find the truth. And unfortunately, it's going to take looking in other places for the truth. That's why we formed frontline doctors here, to try to help get the real information out there.